I had like no health background. I was just playing sports at competitive levels, and so that kind of led me to that. Going up through high school, I ended up having a really tight low back. This was like right before my senior year of high school, and I remember specifically before our first soccer tournament, I could barely stand up without my low back just like absolutely just like squeezing.
Let's talk about root cause. What does it mean to approach something from a root cause perspective?
Yeah, so, it's interesting because it's obviously a hot topic with the whole root cause thing, the functional medicine, all those phrases. And essentially what it means is we're trying to figure out what's causing the health issue. And if we can fix that, then your body will heal itself. By the grace of God, I got connected with the Applied Kinesiology Club, which I'm sure we'll talk about here today. So that technique, and then even more specific than that technique, the systems healthcare technique, which is the primary technique that I use in practice today. And being exposed to those things and then getting the training in those things just totally transformed where I thought the practice and how I would be helping people was to where it is today. I'm a big fan of a whole foods diet, where your food is generally going to need to be prepared rather than taken out of a box and warmed up. And so there's a lot of benefits to that people don't realize. When you are about to eat, the first thing that happens in your digestive system, the first thing that tells your body food is coming is actually breathing in the air of the food cooking and actually seeing it and hearing it.
Welcome back to the podcast. I'm so glad you're here. Today, I'm joined by Dr. Joel Miller, a licensed chiropractic physician and applied kinesiologist. We're diving into holistic health, functional medicine, and how true wellness comes from understanding the body's interconnected systems, including how our thoughts and emotions come together. Dr. Joel explains how functional medicine goes beyond treating just symptoms by finding and addressing root causes. We talk about reversing chronic conditions, the power of nutrition, and why small daily habits actually matter. Dr. Joel also shares how applied kinesiology, specifically muscle testing, helps pinpoint imbalances and guide personalized care to the root cause. So if you're curious how muscle testing works, check out the video in our show notes to see it in action. So if you're curious how muscle testing works, we do include a small demonstration within the episode. So do check it out. If you're ready to discover how holistic, systems-based care can transform your health, let's dive in. Hey, Dr. Joel.
Hello. How are we today?
We're good. How are you?
Doing well. I'm excited for our conversations today and wherever they may lead us.
Likewise. I've been so looking forward for this episode because I've witnessed the power of how you approach holistic health. And I'm just so excited to dive deep into the techniques you use, you work on, to work on healing and also to empower our audience. So I'm just so excited.
That's awesome. Well, I'm excited to get into it as well. Part of the journey in general to getting into the health field for myself just fully revolves around helping other people. So I've been blessed so much by God and everything that I've learned and what He's done for my health. And so there's a lot of freedom and there's a lot of healing that's available for people. And I love to share that.
Yeah, absolutely. And it says that in the name of your clinic, which is Freedom Health. So that's awesome. So before we get into the specifics, can you tell a little bit, or can you share a little bit about your journey on how you got to where you are today and what inspired you to pursue functional medicine as your primary approach to healthcare?
Yeah, it's funny you asked. So we did on our podcast with myself and Dr. Tim, one of our latest episodes was like a meet Dr. Joel, meet Dr. Tim kind of episode. And so we got to talk about a lot of these things in depth. It was funny because I was planning on that episode being a solid like 25 minutes and it ended up going for like 50 minutes. It was pretty long. But essentially my story kind of goes back to high school. So growing up, I had acne and a lot of my friends around me also had acne. And they were taking Accutane, and I would see them be like having so many side effects. They'd be really emotional. They'd just have a lot of issues really with like kind of mental issues and side effects from the medications. And so in the same time, I very quickly noticed that my acne would get worse when I would eat certain foods, and it would get better when I avoided certain foods. And so I also noticed that a probiotic really helped my acne. So very quickly, it was apparent that your body is all connected, number one. Number two, it wants to heal itself. And I had like no health background. I was just playing sports at competitive levels. And so that kind of led me to that. Going up through high school, I ended up having a really tight low back. This was like right before my senior year of high school. And I remember specifically before our first soccer tournament, I could barely stand up without my low back just like absolutely just like squeezing. And there was no way I was going to play the next day. So, in the months leading up to that, I had the tightness and it wasn't improving no matter what I did. I was trying to stretch. I was working out different things. I was running. I was walking. Nothing seemed to help. And at one point, my dad said, hey, let's go get a muscle relaxant and see if this will help. It helped me in the past. It helped my dad in the past and all this stuff. So I went and got a muscle relaxant. And when I went into the doctor, I had not been to a medical doctor. And probably at that point, I was like 17 or 18. And at that point, I probably hadn't been to a medical doctor in like 8 years or something like that. And so I go and it's just like, yeah, my back's really tight, and kind of was looking at maybe getting a muscle relaxant. And they're like, all right. And it was like, looking back, it was like the most professional drug deal that I've ever been a part of. Just for the record, I haven't been a part of any other drug deals, but it seemed like a very professional one where it was like, hey, I need this. You got it. Cool. And so I took it. And for the next week, this was like 1 week leading up to that tournament. For the next week, I had great naps every day at 2 o'clock, 2 to 4 p.m. Great naps. Unfortunately, my back didn't improve at all. And then I had a teammate. His dad was a chiropractor, Dr. Daryl Rich. He's the inspiration and the reason for me even beginning to go to where I am today. And so essentially I'd reached out to him the night before the tournament and asked if he could look at me, check me out kind of the next morning. It was a big ask, but he's the nicest guy and very generous and gracious. And so he said, yeah, he said he would check me out. I forgot to mention that about a week prior, before I got the muscle relaxant, his wife actually was at one of the practices and said, hey, why don't you go see Daryl? Why don't you go see Dr. Rich, see if he can help you? And I thought, well, I've been adjusted before. I don't think that's really going to help with this. This seems more muscular related. And long story short, he looked at me the next morning. I said I had a tight low back. And he said, have you been stretching your hamstrings? Have you been stretching your hip flexors? And I said, that's like the one thing I haven't been doing. And so he was kind of educating me on the iliopsoas muscle, which actually goes from your low back actually to the top of your femur, the long bone in your leg, and how when that's tight, when the hip flexor is tight, it'll pull on the low back. You can have a lot of tightness and things like that. And so he worked on me right there, working through some of the muscles and the fascia, and he adjusted me right there in the grass. I played that first game. I think I scored like 2 goals. And the fact that I was even able to go from like not being able to move the night before to stand up straight to being able to play in that game was awesome. And then kind of a fun thing, we ended up going to the championship game in that tournament, and his son actually is the one that won the game for us, which was really, really cool looking back on it. But
wow.
So that was going through high school. Got to the end of high school, everybody says, what do you want to do when you grow up? All this stuff. What are you going to do for a career? And I thought to myself, I want to help people because there's so much in our healthcare system that's a mess, and there's answers that's available, and the body wants to heal itself. We just have to get to the bottom of things. And so ended up shadowing a bunch of different people, ended up going the chiropractic route for a number of reasons. And when I got to school, I had 2 goals. One was I wanted to learn about the muscles and the fascia, learn how to work with the muscles. And then I also wanted to learn how to adjust. And I figured if I had those 2 things, I could help people with pain, I could help athletes. And that was really exciting to me. The second piece was I wanted to learn about nutrition because I knew everything health related goes back to the internal system and nutrition. And so kind of above all of that, the overwhelming goal was basically, if when I graduate, I want to be able to help any patient that comes in the office, whether they have pain or hormone imbalances or cancer, whatever it is. And by the grace of God, I got connected with the Applied Kinesiology Club, which I'm sure we'll talk about here today. So that technique, and then even more specific than that technique, the systems healthcare technique, which is the primary technique that I use in practice today. And being exposed to those things and then getting the training in those things just totally transformed where I thought the practice and how I would be helping people was to where it is today. And
Wow.
I'm looking back just at some of the overwhelming conclusion and consensus of these last 3 years that I've been in practice, at the types of patients that I've seen, the cases that I've gotten better, and I'm just blown away. I can humbly say that it is extremely abnormal for a patient to come back and say, I'm not getting better. And so, and if they do that, we work on a couple other things during that next visit. And then the next visit, it's like, hey, yeah, that got better. And so when patients come in like 2 visits in a row, especially 3 visits in a row, and they're not getting better, it's like somewhat surprising. And so I'm like,
Yeah.
it just blows my mind that I'm blessed to be able to say that, because I know a lot of doctors, they can't say that. I know a lot of doctors that are, depression is really high in general across most allopathic professionals. So that's my story. Went through the training for the systems healthcare technique, got certified in that, and have been doing that in practice. My first practice I started in Kansas, and was there for personal things. Ended up a lot of different things changed in my life there, and decided, hey, I don't want to live and stay in Kansas. So ended up moving down here and starting this practice down here almost 2 years ago. And I can't believe time
In Dallas,
flying.
Texas.
In Dallas, Texas. Yep. Here in Flower Mound. But it's been a joy, and it's been a blast getting to help people, obviously, throughout in Kansas. Would have patients come down from Nebraska, would have patients come from Missouri, all kinds of things. And then here in Dallas, it's just blown my mind, just like, again, all out of humility and grace, glory given to God, but like patients flying in from Canada and coming from different multiple states away and stuff like that. And of course, Texas is huge anyway, so driving across Texas in general is a huge thing. So I'm super thankful and super honored by all the people that I get to see and all the people that God brings in front of me. So that's a little bit about my story, and brings us here where we are today. Freedom, Health, and Wellness is the name of the practice. The part of my story also includes that name, with the purpose being that people would be set free from their health issues, but that they would also be set free from any spiritual bondage that is part of life and our sin nature, and with the true freedom being found in Jesus. And so I know that we have slightly different faiths and so forth, and happy to always chat about those things. But that's the practice. It's here in Flower Mound, Texas, and we see anybody from kids struggling with gut issues, ADHD issues, skin issues, to adults struggling with hormone issues, autoimmune problems, chronic pain, brain fog, thyroid problems. I mean, the list goes on and on. Every single day is different, which is really exciting, and every single patient is different, which is also exciting. So it definitely keeps me on my toes.
Yes, absolutely. What a profound background, Dr. Joel. I mean, I was just listening because, I come to your practice almost every month for the past 2 to 3 months as we're working on my autoimmune journey. And I didn't know all this, right? Because we just kind of, meet, we work through what we have to, and then we part ways. But, this is a chance for me to also get to know you, and for our audience to also get to know you. And it's just amazing to see that, you have such a rich background, and it's full of meaning. I think that it's very important that, we always get to the root cause of things. And, I think I shared this with you when we first met. I had met many doctors to heal my autoimmune condition. And I always believe that it is reversible. I just haven't found that doctor to tell me it is reversible. And when I spoke to you over the phone, you instilled a sense of faith in me. And I think it's also important to work with a doctor that believes in you just as much as you do in yourself. Because if I have faith in myself that I can heal, but the doctor doesn't, it's like, what am I, where am I, who am I working with? Is this even worth it? Am I putting my time and energy in the right place? But when I spoke to you, I just knew, I had like my hopes were high. And by the second visit, like you said, I was so excited to see you. And I literally told you that I'm feeling so much better. And you were like, that's what it is. And so I think I'm definitely a witness of that. My second visit pretty much changed everything for me. So yeah, so let's get into, education. So let's talk about root cause. What does it mean to approach something from a root cause perspective?
Yeah. So, it's interesting because it's obviously a hot topic with,
Yes,
in a lot of the health
functional medicine. The
whole root cause thing, the functional medicine, all those phrases. And essentially what it means is we're trying to figure out what's causing the health issue. And if we can fix that, then your body will heal itself. And it's kind of crazy that, I say that, and of course people say, yeah, absolutely. But it's crazy that that's not our first thought, and that's not how we naturally think. Because oftentimes when I say that statement that we want to get to the bottom of things, address that correctly so the body heals itself, when I say that, that is not like the status quo in healthcare. And that blows my mind. The status quo, which is not usually spoken out loud, it's just what happens, is here's your symptoms, here's your drug or medication, and let's see how it goes. And number one, we're not even trying to support the body in healing itself. A lot of times we're chemically trying to manipulate the body, and then two,
to get rid of the symptoms.
Yes, totally, just addressing the symptoms, which whenever you address the symptoms with something, there's usually going to be other symptoms that form because your body is beautifully designed and created, and it's not just a robot. It's an intelligent design. And so it's going to adapt around different drugs and medications and things like that. And so that's one of the biggest problems in our healthcare system today, for sure, is doctors are not trying to get to the bottom of things. And for the doctors that are trying to get to the bottom of things to figure out what's actually causing things, that's number one, awesome. And I love that. But number two is like, what systems are we using to do that? Because we have lab work, which can be very helpful. But really outside of that and a good history, it can sometimes be really difficult to figure those things out. And that's where I love the applied kinesiology and systems healthcare approaches, because more than anything else that I've been exposed to, they've been really able to get to the bottom of things rather quickly.
Yes.
But yeah, root cause is definitely what you want to go for. And, there's a lot of doctors, there's a lot of practitioners that claim to kind of be focused on the root cause approach. And I've had a number of patients that had been to some different people that said they were root cause, and then they just prescribed things for the symptoms. And so, you kind of want to take it step by step with each practitioner. But root cause approach is definitely where I think our healthcare system is heading. And I think we've seen a huge revolution since COVID and all this other nasty stuff the last 2 years, that people are actually waking up a little bit and seeing how bad our healthcare system is in America right now.
Yeah. And, to your point about root cause, I have worked, not for a long time, but I have approached doctors who do claim that they are a root cause, a doctor that practices root cause. And what I had found is, it's just, I get these labs done. There are some markers that are out of balance. They prescribe me some supplements instead of drugs. And they try to, bring up those markers, and that's it. But that's really not root cause, because there's much more underneath. So for example, when you looked at my work, my blood work, you said my iron was low. But my iron wasn't low just because I wasn't taking enough iron, because I had other inflammation, other infections and toxicities, right? So that to me was root cause. And that was mind blowing to hear is, look, all these parasites and infections are eating away your iron, which is why it's low. So no matter how much I increase my iron intake, my iron is still gonna be low. So let's address the infections and the parasites and all of this. So that to me was proper root cause approach. So I know you talked a little bit about systems healthcare, and that's how you kind of got started into root cause. So can you talk to me a little bit about systems healthcare?
Yeah, so systems healthcare is the best thing in healthcare that nobody knows about. Now,
Yes.
I have to preface this by saying this is not my technique. This technique was founded by Dr. Stephen Gangemi. He still practices today. He is one of the best, if not the best, doctors that I have been around, and certainly the best that I've been able to learn from. He's been practicing for 27 years, I think now. And, he's actually gotten to learn from a lot of the greats, but he himself, through his work, has actually become one of the, I think, greatest teachers and kind of pioneers in the holistic healthcare world. So systems healthcare really is a combination of things learned from applied kinesiology, which we'll talk about, plus his experience in learning just over 27 years of practice, clinical experience. And, one of the things that we talk about in school is there's a number of different kind of levels when it comes to like informed, or when it comes to evidence-based, healthcare. So you have, you have the person that is going to, you have the person that's going to do research on what's happening in the clinic. So you have that person that's kind of observing and then kind of, reading, writing, all those things. You have the person that's studying that research. Okay. And then you, lastly, and maybe most importantly, you have the actual clinician who's actually in the front lines working with people. And a lot of times people are learning from the research. They're doing their own research, which is good. And they're reading the research, which is good. But being on the front lines, being in the room with people, being the one that's getting the hands on and working with people and getting to the bottom of things, that person will always, 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 always be the most evidence-based, because they're working with people who, every person is extremely different. And they're actually there, just getting, again, hands-on and getting right into things. And so when we look at like Dr. Stephen Gangemi, for example, practicing 27 years, the amount of things that someone can learn over that time when they start their career with some kind of technique that helps them get to the root of things. And then, of course, they help a lot of people. There might be some people that they aren't able to help, but then they learn from that. And so if they have a case, let's say, that has some kind of chronic gut issue, and for whatever reason, they're not able to help that, well, they learn from that. And then years down the road, they continue to learn, continue to discover different things. And then you get to a point where now what in the past was maybe really difficult to get to the bottom of, now we're really able to get to the bottom of it quite easily. So 27 years of experience, to me, just speaks volumes. You can't read enough books to gain that much information and value. And so he's taken all that he's learned. He got to work with Wally Schmidt, who I'll share a little bit about him in a little bit. And a lot of the systems healthcare technique is also built off of Wally Schmidt and what he was doing with his techniques. And so, so that's systems healthcare. There's about 18 people in the country right now. I think it's 18 certified in the technique, which blows my mind. And again, it's not a technique I knew anything about until I got to school, and they said, yeah, that's systems healthcare. And I was like, what was that? Or what is that? And I first kind of shadowed a couple of times even, with one of my mentors and colleagues now, and watched him do systems healthcare on people. And one of the interesting thing about systems healthcare is we don't do any adjusting. Like we don't do any popping, which as a chiropractor, I feel like I'm going against my own people. But when you understand that the nervous system is built off of our internal system, as well as our fascial system, if you address those two things, you don't even have to pop things. The spine will go back into alignment. All the inflammation will go away and your nervous system will heal itself. And so, I got to learn that, of course, as I was a patient, originally. And then when I became sold on this approach and started learning it, I just saw it day after day after day with patients that, they might come in with a neck or hip issue or whatever. Most of the time, yeah, adjusting it would help. It would release some tension and stuff with the tissues. But ultimately, if you work through the fascia and you balance out the fascia, but then also figure out what's triggering things internally, not only will the pain and the soreness and all that go away, it'll actually stay gone because you're actually getting to the root of the issue. So that's one of the things I love about systems healthcare. Again, it just is able to get to the root of the issue. And and there's other good and amazing techniques out there. I would say there's maybe one or two other different techniques, but I would say systems healthcare is definitely one of the best techniques in the world.
That's awesome. So I know you talked a little bit about how applied kinesiology goes into systems healthcare. Can you talk to me a little bit about that?
Yeah. So applied kinesiology was founded by a gentleman named Dr. George Goodhart. So Dr. George Goodhart was a chiropractor, and he was always reading, always researching, always studying. And he essentially, the first scenario here, he had a patient that had a winged scapula, which basically means, sorry, this little thing. He had a winging scapula. So as he would look at the back of the patient, one of the shoulder blades would kind of wing out a little bit. And he was thinking to himself, okay, so the serratus anterior muscle, which attaches on the front of the ribs and then goes around back to the shoulder blade, the scapula, that muscle obviously is not activated. And so he took the patient's arm, put it in a certain position to where he could test that muscle. And he basically said, all right, patient, I want you to hold this muscle strong. He pressed on it and that muscle was not activated. He tried the same thing with some other muscles and they would activate, they would lock in. And so he went in there and he palpated in the muscle of the serratus anterior and he found a bunch of little nodules, little trigger points. So he massaged all those out and got into it really well. He tested the muscle again. It was activated. He had the patient stand up again, put his hands on the wall and basically activate those muscles to see and really put the shoulder blade in a position to where we could see if it was winging or not. And the scapula of the shoulder blade was no longer winging. And so that's where he kind of that was in about 1964. He discovered basically this muscle testing component. And over the following years, he started to he just took that and he just ran with it so far. He started realizing that you can use that obviously to check what might need adjusted, if there's different work with the muscles that need to be done. He started realizing, this is me kind of concluding here with that, is he started realizing you can test the nervous system through the muscles. And after he realized, again, like everything with the muscles and the fascia, the joints, all these things, he started getting into those relationships with organs. And he discovered that, hey, there's actually, based on embryological development, which is, development as we're a fetus, we're in our mom and we're developing, there's connections that form between muscles and organs. And so he discovered that. And that's why, for example, when people have chronic back issues, low back issues, they usually have gut issues. Because when you have that inflammation in the gut, it causes the core muscles to not be activated. And if your core is not activated, then you have an unstable core. If you have an unstable core, now you start developing disc issues in the low back. The vertebra all kind of tighten up with the paraspinal muscles and results in all kinds of issues. So there was also the discovery of what's called neurolymphatic reflexes. These are also referred to as Chapman's reflexes. So Dr. Frank Chapman was an osteopathic doctor, and he realized there are different reflexes on the body related to different organs, that if you treat those reflexes manually by massaging the reflex deeply, it'll actually stimulate and support that organ temporarily. And so Dr. George Goodhart took those and started working with those. You take his work there, fast forward to today, which is, almost, I guess essentially 61 years from the original, kind of muscle test being learned and discovered there. And now we have things like systems healthcare and a variety of other different techniques and approaches that are really, really stinking cool at getting to the bottom of things. Yeah. There's times when it doesn't matter what lab test someone's done. If they've spent all the money in the world doing the best lab tests in the world, it sometimes still won't get to the bottom of things as quickly and as efficiently as systems healthcare can. So that goes back again, though, to applied kinesiology, the muscle testing, a lot of the basic reflexes there. All of those things are what Dr. Stephen Gentjimmy had going into practice. And he took things he learned from Wally Schmidt, who was one of his mentors and he practiced with for quite a while, and just kind of put everything together and continued to learn and grow. Wally Schmidt was Dr. George Goodhart's best friend and neighbor growing up. And so while Dr. George Goodhart passed away in 2008, Wally Schmidt, who was again his best friend, continued practicing for almost 10, 12 years later, 12 or 13 years later. Unfortunately, Dr. Wally Schmidt passed away within the last 5 years. I don't have the specific year on the top of my head, but recently within the past few years. And it was a big, obviously a big moment for the history of applied kinesiology. Dr. Wally Schmidt discovered so many things. And he has his own technique called quintessential applications, which has, I don't know the technique. I've been exposed to it a little bit, but it's one of those techniques, again, that's very good. It uses the nervous system to get to the bottom of things. And a lot of people have found really good results of that. So that's applied kinesiology. The official website is icak.com, International College of Applied Kinesiology. For our listeners, if you're wanting to find someone that does that technique or is studied and skilled in those approaches, you can go on there and find a doc. You can look to see who's close to you. And then systems healthcare, which I'm always going to recommend as the kind of number one approach. You can go to systemshealthcare.net and find resources on there as well. But yeah, that's applied kinesiology and systems healthcare in the connection there.
Yeah, and it's amazing because when I was at your practice for my very first visit, it was 2.5 hours, right?
It was supposed to be 2, but we got talking,
2.
I think.
Yeah, we had a lot to uncover.
We had a lot to work on.
And so I was mind blown because as you were working on me, trying to get my muscles to activate and, trying to, just get to the root cause, I was like, what is going on? Because you were working on my, like this upper body at one point and then the lower body at one point, the legs. So you were constantly, going from one side of the bed to the other side. And to me, it was just fascinating because you were rubbing on my shoulder and then you did something with my leg. And it did something, you would write it down and I would be like, okay, what is he finding? Yeah. And you even told me that, one of your patients said that, is this some witchcraft?
Oh, yeah.
And so it was just amazing to see and witness. So that to me is basically viewing the body as an interconnected system because you're literally going from head to toe. So can you discuss an example of a time and maybe even a few stories of how you view the body as an interconnected system and how it helped uncover the root cause of a health condition or health issue?
Yeah, for sure. So I'll share a couple. One of the stories that I had heard when I was in school from someone I had learned from quite a bit in St. Louis, Missouri. This guy, he did applied kinesiology. He didn't do like systems healthcare, but a lot of the core applied kinesiology stuff. And he had a guy come in who couldn't turn his head. He couldn't move his head. And the guy had been to, I think at that point, maybe 3 like chiropractors, maybe one kind of his main chiropractor. And the guy had gone to a couple of different specialists and nobody could help him. And so this chiropractor who does applied kinesiology, he's testing this guy and he's testing like the different neck muscles and things like that. And he finds that there is a subluxation or kind of joint dysfunction or kind of fascial imbalance with like the big toe on the right foot. So what does he do? He spends all this time kind of testing to figure out where the issue is. He adjusts the guy's big toe. And then he says, all right, I want you to sit up. I want you to move your head and see what that feels like. And of course the guy's like, you just popped my toe. That's all you did. The guy stands up and like all of his range of motion is back. Wow. Like all of his range of motion came back. And basically what happened was the guy had jammed his toe apparently, several weeks or months prior. And there's fascial connections. If you look up fascial planes on Google, just look up images, you'll see that there's fascia that starts at the tip of your big toe, goes along the back or the bottom of your foot, the back of your leg, around the hip region, it crosses over, goes up to the other side shoulder, and then up into your skull. And so essentially what was happening was that was jammed and kind of injured, and it was pulling all the way from his toe all the way up to his head, causing him to not be able to like move his neck.
It reminds me of acupuncture points where like the meridians are connected or along the body. Yeah,
totally. And what's interesting about acupuncture, it's very helpful. I learned acupuncture in school and it's, again, super helpful. A lot of people find benefits from it. One of the things that I've learned along the way is your nutrition can change how your acupuncture meridians function. What you think can change how your acupuncture meridians function. how you move, or if you move, can change how your acupuncture meridians function. And at the same time, how those meridians function can change your digestion, can change your hormones, can change your overall muscular tightness and tension and all that stuff. And so one of the things I learned as I was working on people and also learning acupuncture is I would use the muscle testing to test their acupuncture meridians and see if they were healthy, if they were balanced, all this stuff. And a lot of times what I found was it would go back to fascial imbalances. Keep in mind that acupuncture meridians run where they run through the fascia. And then I'd also find that there were internal imbalances. And again, if you fix both of those things, the meridians will balance out. And so it was really cool kind of being able to learn that. But yeah, acupuncture is some pretty cool stuff too.
Wow.
Yeah.
I know for me, acupuncture helped me a lot for my pain because of inflammation. I was experiencing a lot of pain, and I would get acupuncture 2 or 3 times a week, and it would help me. But obviously didn't get to the root of it, so the pain kept coming back. And then once we addressed the inflammation, definitely the pain drastically lowered, because I remember at my second visit, I was just like, Dr. Joel, I can actually wash the dishes again.
Yeah.
It's the little things that you can't do when you have these chronic conditions.
Yep.
So do you have another story that is along the lines of someone experiencing a chronic condition? And I also want to kind of get to what chronic means and how they can be reversed. But before we get into that, I want to also have our viewers and listeners hear a story so that it kind of sets the stage.
For sure. Yeah. So I'll think of, I got a couple here. So, and keep in mind, like I mentioned, like, you came in maybe second or third visit and was feeling so much better.
Second. Yeah.
That's like, I'm so spoiled and blessed to be able to say that happens like every single day. And so,
and I told you that you have some magician skills.
Yeah, right.
Yeah.
Yeah. People say that and they're funny, and I just kind of laugh about it. I'm thankful for whatever skills I do have and gifts I do have. But I had one lady come in. She started last year. Now I think I see her maybe every 2 months or something just to check in. But saw her last year. She was going to have her gallbladder removed, and she was wanting to give it one last shot with this holistic stuff. And she had a friend that said, hey, you got to go see this guy, Dr. Joel, and I think he can help you. And so she comes in, she's basically having gallbladder attacks like 2 or 3 a week, and just absolutely miserable. She'd be up for 3-4 hours at night and things like that. She'd go to her primary doctor, and of course they said, hey, let's take your gallbladder out, which they say like every time. And one of the things most people don't realize is, just like a lot of conditions, you can actually reverse gallbladder issues. You can actually heal that system and avoid surgery. Just like with autoimmune conditions, you can reverse them and get rid of them. I had a little girl that we had our first visit this morning, and she was diagnosed with eosinophilic esophagitis, which is basically an allergy that triggers all this inflammation with your esophagus. You get all kinds of like reflux. And basically this girl, she's 10 years old. She's been having this thing for like 2 years. She has to walk around with her mouth closed.
Wow.
Mindfully, she's thinking about that because otherwise she might spit up. And they've been to a bunch of doctors and they've recommended a lot of different things. And one of the things that we were talking about in our history, I was like, what are our goals? And I asked that with every patient our first visit, like, what are our goals here? And she was kind of thinking, and I was like, so how about reverse and get rid of the EOE, the eosinophilic esophagitis? And she was like, you can get rid of that? I was like, yeah, and we're going to get rid of it. And, by the grace of God, we're going to get rid of it. And it was just like, she was convinced she was going to have it forever because a bunch of doctors told her that you can't get rid of that stuff. I've had countless stories with people with Hashimoto's. Their endocrinologist tells them they can't get rid of Hashimoto's. You 100% can. You have to get to the bottom of it, figure out what the trigger is, and then address that, and then balance out the immune system. But back to the patient with the gallbladder attack, she's having multiple every week. So we jump into things, and a lot of times with chronic gallbladder issues, gallbladder attacks, we'll find issues with the gut health, stressing the bile flow and stressing the liver. And so essentially she had things like parasite infections. She had ammonia toxicities, which are really common to come from parasites and chronic gut issues. And so we addressed those things. And then she also needed a lot of support for bile flow. So what is bile? Bile is made in your liver. Bile flows through your gallbladder, and it helps with breaking down and digesting fats. It helps with keeping food moving through your intestines so you don't get constipated. Helps with absorbing fats so you don't have dry skin, and all these things. And she needed extremely high doses of vitamin A. She needed some other different nutrients like choline and stuff like that that helps move the bile. And one of the things that happens with gallbladder attacks is the bile gets really, really thick. And when it gets thick, it starts forming the gall stones. And again, most docs will say, oh, you can't reverse those. You got to take it out. It's not true. And so we were working on things. Basically we got to the point where she wasn't having any gallbladder attacks anymore. I'm trying to remember. I know she had an ultrasound on her gallbladder. Or maybe I think she had one coming up. So we'll get those results back soon. But by the look of it and how her body's functioning, like her gallbladder's good. Her gallbladder's good. And we've had multiple times too where they've gone and gotten the ultrasound and the stones were gone. Like the gallstones were just gone. So we've had that quite a bit of times. Another fun story, I had a patient in Virginia. I grew up in Virginia. Just a little background info. Yeah, right. I forgot about that. And so when I travel back, sometimes I'll see patients there that are just usually more like close friends and family and type stuff. But had this patient, she had basically a lot of different heart inflammation and pain. And it started when she started a woodworking business without wearing protective equipment. So she was breathing in all this dust. All of a sudden she goes to the gym and she can't breathe very well. She's out of breath. So obviously her lungs are probably inflamed, and whatever else is going on. Eventually she starts having heart symptoms like pain in her chest and stuff like that. Her doctor doesn't really know what's going on, sends her to a cardiologist. They do some scans. They say, oh, you need a stent put in. They put a stent in her heart. She did not need a stent put in her heart. The heart was overall not amazing, but it definitely wasn't bad. And her heart definitely wasn't the issue that she was having with everything. So she had the stent put in. She was just listening to her medical professionals and what they recommended. Had the stent put in, and then still having these issues. And so she got connected with me. So we're working on things. We found different infections, inflammation, toxins, all kinds of stuff that we addressed. One of the last things that we found as to how and why she was still having some of this pain and stuff was she was testing us having a lot of heart inflammation. Did I tell you this story yet, Delka?
No, so it's my first time. Heart inflammation. It's actually my first time hearing that.
Yeah. So she had a lot of heart inflammation and her heart was just like hurting, like aching in her chest. And of course, that's a scary thing. Most people think they're going to have a heart attack or something like that. So she has this inflammation. Well, what she's testing for needing is arachidonic acid. Arachidonic acid is found in butter. And so she's testing as needing butter, specifically grass-fed butter, for her heart. And so that's crazy thing number one. Crazy thing number two is the way things were testing. I prescribed her 1 stick of butter a day. That's crazy thing number two. Crazy thing number three is she listened to me. And then I guess crazy thing number four was she said about 3 days, within 3 days, all of the heart inflammation and pain was gone. 3 days. And she needed butter. So it's mind blowing to me how you can literally get to that specific ingredient. Like you were telling me that I needed iodine, and my iodine levels were fine on the paper, but you were like, no, you still need more iodine. And I was just like, how do you know that I need this specific ingredient? And the crazy thing is just like how you said, you knew exactly how much more or less protein I needed in grams. And so I think that to me is mind blowing when it comes to systems healthcare, applied kinesiology. The mix of both is you can literally get to the root cause, and not even root cause, the root of what you need as well. Not just what's going on, but what you need to kind of feel better and just be healthy again. Yeah. Yeah. It blows my mind every single day that you can actually, number one, figure out what's causing the problem, which is like the first $1 million question. And then instead
Yes.
of just trying different things, trying different approaches, we can actually, with the same technique, test like, okay, what do you need to fix this? What does your body need to fix this issue? And
Yeah.
we do both of those things, and we find that it's extremely accurate as long as you know what you're doing as a practitioner, and extremely effective at helping the body to kind of heal itself.
Yeah, absolutely. So in your practice and in your experience, what are some of the root causes that you have seen to be the challenges of someone's health condition? And what are those conditions specifically as well?
Yeah, so it's kind of an interesting question. And I try not to get too like philosophical about it, but a lot of the root causes go back to infections, so that could be parasites, could be bacteria, could be fungus, could be viruses. It goes back to
Inflammation.
inflammation.
That's a
It goes
huge
back to
one.
toxicities. It goes back to deficiencies. And I would say those are usually at the core of things. And every once in a while, there can be emotional root causes. So the emotional root causes are a little bit trickier to kind of figure out, but not impossible nonetheless. But emotional root causes would be like if you're holding on to like anger for something someone did to you years ago. Interestingly enough, we can still figure that out with the systems healthcare technique, which is really cool.
Wow.
And so emotional stuff can sometimes be a root cause. And I would argue spiritual things can also be a root cause. I think that's seen throughout the scriptures, that when someone is, let's say, the old lady, I think she was in like Luke 13, the lady that was bent over at the back. I'm like just looking this up real quick. Make sure I have the reference right here. But yeah, the crippled woman. So in Luke 13, this lady is bent over and she couldn't straighten up at all. And what's interesting, if you kind of read on in the passage, Jesus says, this woman whom Satan has kept bound for 18 years, should she, the woman that was over at the back, she couldn't stand up. And of course, to the normal eye, what that looks like is, oh, maybe she had chronic arthritis issues and that kind of thing. Maybe she was in an accident. And Jesus was healing people that day, as he often did. And the Pharisees were getting on him for healing on the Sabbath. But Jesus said, this woman whom Satan had bound for 18 years, should she not be healed on the Sabbath day? And so what was really interesting in that whole passage was, did the lady have arthritis? I mean, probably. She was an old lady, as it says. Did Jesus heal her to where she could stand up? Yeah, he did. And what did he accredit that to? He actually accredited it to Satan binding her for 18 years. And there's a lot more conversation I think that can follow that, but it's kind of an interesting thing that sometimes the root cause can also be spiritual, I would argue. So, but infections, toxins, inflammation, deficiencies, all those things are super, super important. And when we're working on the body healing itself, we need to address those things. But honestly, health goes even further than that, because if you just get rid of those things, but you don't change and improve how you live, then a lot of times those things will come back. And so that's where we talk about nutrition. That's where we talk about lifestyle. That's where we talk about sleep, our mind, our thoughts. And then again, I would argue our spiritual health is extremely important. So all of those things, once you, all of those things help you get healthy. And those things are especially important for staying healthy. And so they're definitely a part of the conversation, I think.
Yeah, no, 100%. I agree that when you have a sense of faith, whether it's in the doctor that you're working with, whether if it's in the higher power, the universe, or God, whoever it is, when we have that sense of faith, it really does move us. It really does help healing a lot easier. It helps make it so much easier because you have a sense of trust. And it just, everything just falls into place afterwards. And I think that the fact that you said, healing is possible, we can reverse a lot of these conditions. To our listeners, can you just name a few conditions that can be reversed? Because just like the little girl, oh, it can be reversed. That's that was my very first thing when I heard of autoimmunes can be reversed. I was like, it can be reversed. I thought it was a lifelong thing that I'm stuck with. So can you name a few? I know we talked about diabetes, we talked about asthma, and migraine headaches. What else?
Yeah. So there are some conditions that cannot be reversed necessarily. And so I'll try to kind of flesh those apart. But a lot of the conditions that can be reversed is autoimmune conditions. I would say every single autoimmune condition can absolutely be stopped. And then I would say 99% of them can fully be reversed. The ones that are really hard in those situations are things like multiple sclerosis, where there's been a lot of damage done to the nerve fibers, and essentially healing those and so forth can be really, really tricky and time consuming. I would say things like irritable bowel syndrome. I would say irritable bowel disease, Crohn's, and ulcerative colitis. Your body can heal from that. I would say chronic skin issues, things like eczema, things like psoriasis, which is also an autoimmune issue. Those things can be healed. Your body can heal from those things. I would say acne. While we're on the skin topic, I would say even arthritis is actually interesting, because with arthritis on an x-ray, it looks terrible, but you can actually get rid of the inflammation and actually support the nutrients and hydration of those tissues to where you can get rid of the pain and be able to move freely. Now, it's interesting because if you get to that point and then you take an x-ray again, a lot of times the arthritis is still there, but the way that your body is functioning is night and day different. I would say anxiety and depression is definitely a top one that we see. I would say things like, having Lyme disease, having Epstein-Barr virus and mono. I would say those are things that you can 100% get rid of. It's just, I think with a lot of these conditions, I think they can just be really, really hard. And I think that's why a lot of times people, doctors and health professionals just kind of lean more towards the conclusion of, oh, it's not possible to get rid of these things. It is possible. There's just not a lot of people that are really kind of helping people with that. And there's not a lot of people that have kind of figured that out. But it really starts with kind of understanding how the body functions and understanding kind of like root cause approach, what that looks like. Heart disease, you can definitely get to the bottom of. Kidney failure, you can definitely, your body can definitely heal from that. Cancer, your body can definitely heal from that. That one is a huge hot topic of things for a number of reasons. But it's one of those things where, again, your body, everything it does for a reason. Every single inflammation process, every single thing it does for a reason. We just have to figure out why it's doing that, and then what your body needs to heal from that. So those are a number of things. There's so many other conditions that are, really possible to heal from. Some that are really, really tricky are things like ALS, Huntington's disease, Alzheimer's, stuff like that. Those things are really tricky to like fully reverse. But oftentimes you can significantly slow it down, if not essentially stop its progression with things. So again, there's a lot of factors with each of those conditions, things like the mind, things like overall spiritual health. I would say obviously nutrition and lifestyle, all of those things play a factor with things. But as far as hope goes, a lot of those things can significantly improve, if not fully reverse.
Yeah, absolutely. And you mentioned, some cannot be reversed. And is it because the damage, I know you mentioned a little bit about this, the damage is already done. So is there a way to prevent those from happening in the first place? Maybe through getting routine exams, like anything like that?
Yeah, for sure. So obviously family history is important. Your genetics do play a part in your health. I'm much more of an advocate for discussing the epigenetics, which is basically the factors that actually control your genetics and determine whether or not your genetics are expressing themselves in one way or another. To put that in another way, you could have your great-grandfather, your grandfather, and your dad could all have heart disease issues. And so what does that mean? It means, well, you may have heart disease issues. But in reality, if you understand the genetics and how they function, there's no guarantee that you're going to have heart issues. What what it means though is if your health and your environment, your nutrition, your chemistry, your inflammation, your mind, if all of those things are unhealthy, to put it simply, then your genes will express in that way that your health
Right.
issue will probably be high blood pressure and heart problems. Whereas another person can eat all the junk in the world, have all the inflammation, think toxic thoughts all the time, and they don't get heart disease, but they get diabetes, or they get some kind of autoimmune problem or chronic irritable bowel syndrome. So the genetics are important, but the epigenetics are way more empowering, and I would say way more inside of your control with things overall. So,
yeah, definitely. And the way I like to kind of phrase this when we have our family discussions on, the history repeating itself is, if my grandfather or grandmother had a certain condition and my mom had that condition, yes, I may be likely to have it because I am living the same lifestyle because I grew up in the same household.
Yeah.
However, if I want to break that, I have to pivot and create a different lifestyle for myself and change my nutrition, change my way of living, my thoughts, heal my trauma, heal my, whatever it is that have been in the lineage, right? So I totally agree. And I'm all about breaking the chain because I definitely don't think that we deserve to live in the same conditions as our, grandparents and parents did. And it's primarily because we want our next generations to be healthy. So now let's talk a little bit about importance of focusing on keeping our body at an optimal stage. So I know you talk a lot about gut health, immune health, and just keeping our overall nutrition intake appropriate. Can you give our listeners some tips on how to be more mindful when it comes to eating, drinking, and living?
Yeah, for sure.
So the mind, body, soul connection.
Yeah, absolutely. And I know these are a lot of things that you talk about, which I think are awesome. You mentioned a little bit ago about, prevention, and to touch on that, if you know from your family history that there's different things you may be prone to, it's not a bad idea to have those things checked via testing once a year, once every 5 years, depending on how old you are. But I would say even more than that, the best healthcare for yourself now and in the future is preventative healthcare, which means go work with a holistic doctor that's going to help your body to become as healthy as possible today. Most people are worried about their health issues 10 years from now, 20 years from now, 30 years from now, when they're not worried about their health issues now. Here's a really cool thing. If you're healthy now, you're automatically more likely to be healthy in the future. And so I tell people, focus on your health now and take it serious now so that in the future you don't have to worry about that so much. So nutrition. Yeah, go ahead.
Yeah. No, I was just going to say that, many people in the 20s think that they have a long life ahead to worry about health. But I'm like, okay, you're in your 20s. This is the best time to keep your health at optimal state, because if you're not, you're going to suffer in your 30s. And if you're going to repeat the same thing in your 30s, it's going to happen in the 40s, and it's just going to keep going.
Yeah.
So,
your body
definitely.
Your body is insanely resilient in your 20s. And a lot of people push it so hard that they still have health problems. The body can only adapt so much. And so if your nutrition is terrible every single day, if you're not moving very much every single day, if you're, again, just chronic issues that you're not fixing and addressing, your body will do its best to adapt and adjust. But if you're having issues in your 20s, I would say that, there's something there that's either been there a while as a root cause, or there's certain things that need improvement. That goes back to my story of, I, have learned so much about how to eat and how to live and things like that. And I'm always learning every single day. But, I've had issues in the past, 5 years and things like that because of what I was eating. I knew a lot about nutrition, but I didn't know everything. And so I was actually eating some things that were actually bad for me. And I wasn't eating certain things that I needed to eat, or maybe I wasn't eating enough, which is a huge problem in and of itself. And so, I've continued to learn and continue to grow to try to address issues that have been there. And overall just become as healthy as possible. So what does that look like? So I would say one of the cool things about health is there's so much that you can learn on the internet today that's absolutely free. You can listen to podcasts like yours. You can research different doctors. There's so many different like holistic doctors online these days, and people that aren't holistic, they just know their stuff. They just know how to be healthy.
Yeah.
And there's so many people that you can listen to and get thoughts on. And so I recommend following those people, listen to their videos, listen to their episodes and all that good stuff. What you're going to learn about and what you should be focusing on learning about is nutrition, how to eat, what foods to eat. What does that look like? I'm a big fan of a whole foods diet, where your food is generally going to need to be prepared rather than taken out of a box and warmed up. And so there's a lot of benefits to that people don't realize. When you are about to eat, the first thing that happens in your digestive system, the first thing that tells your body food is coming, is actually breathing in the air of the food cooking and actually seeing it and hearing it. And so when that happens, your body automatically starts making enzymes to digest the food. And so when you go through the fast food line and you just get something really quick, you get about 3 seconds to smell that burrito before you eat it. You know what I mean? So the digestive enzymes are not being formed. So how well are you going to digest your food? Well, probably not super well. Of course, the ingredients are going to be pretty trash anyways. But whole foods diet, eating foods that have one single ingredient, a banana is a banana, and things like that. I'm a big fan of 3 meals a day, with about 4 to 5 hours in between. That gives your body time to process the food. It gives your body time to do kind of a self-cleansing process. And that whole thing takes 2 hours and 2 hours. So at least 4. So roughly going 4 to 5 hours without food, only drink, is amazing for your gut, for digestion and getting ready for the next meal. So because of that, I'm not a big fan of snacking. I tell people if you're hungry after your meal or you get hungry before your next meal, it means you didn't eat enough protein, or you didn't eat enough fats. And most people are not eating enough, especially protein. So that's huge.
It's all about how you plate it, right?
It's about how you plate it. Absolutely. And so carbohydrates are good as well. Of course, we need those, but most of the time I'm telling people focus on protein first with your meal, decide what your protein source is going to be, consider fats, and then let carbs kind of be the last thing you think about. I usually recommend people get, for women, usually 100 grams of protein a day, and for guys, anywhere from 120 to 150 grams of protein a day. I usually will aim, for myself for around 180 to 200 grams a day. But that's because, I'm also usually working quite a bit. And then also,
And you're always on your feet.
Yeah.
You're always standing. You never sit.
always standing. I never sit in the office. Yeah. Always standing. And then, working out and things like too, having the physical stress on the body and the muscles. My body needs a lot of protein to handle the stress. And so, I usually will do that. So, what's crazy is most patients that I've had that have lost a lot of weight. I've had patients that I may have shared this with you. I've had a patient that, actually 2 sisters, one of them lost 40 pounds. I think she went from maybe 200 to 160 or something like that. And then I had another one. She was, the other sister, she was 220. She lost 60 pounds. She went down to around 160. And I was looking at her note as we were talking, and I was just I look over at them and I'm like, have I ever mentioned the word exercise to either one of you? They both kind of look around, trying to think if I've ever done it, if I've ever said exercise or anything. And they're like, no. And they literally lost 40 pounds and 60 pounds just by changing how they eat. That's it. Wow. These people aren't running marathons. They're not running. I don't even think either of them run. I don't think they really work out. They might go on walks, but they just change their nutrition. And so, what I've found is in changing your nutrition and balancing your hormones, most people need to eat more, specifically more protein, and then just nutrient dense.
Because of the lifestyle.
Yeah, because of lifestyle, and protein is just the number one thing that supports your body against cortisol. And so cortisol is the number one stress hormone. It's going to cause you to age faster. It's going to cause you to essentially die quicker. And so, you have so many people like our age, Stolica, that have gray hair and bags under their eyes and, joint pains and all these different things. And it's their body might be in their mid 20s, but it feels like it's in their mid 40s because of how they take care of it. So cortisol, it's one of the number one hormones that will help with that process, and protein helps significantly with that. So aside from nutrition, obviously movement is super important. Most people don't move enough, and it doesn't even have to be a ton. Going on a walk for 30 minutes to an hour a day is amazing for you. Obviously being outside is helpful as well with that. And then I always recommend, like, whatever you enjoy doing, you like playing sports, you like lifting weights, whatever, go do that. Like, enjoy it. Let movement be,
Whatever's mindful for you.
yeah,
Yeah.
whatever's mindful for you, whatever you enjoy, go and do those things. And so most people, they either don't move enough or they move way too much, which means they're running marathons, they're hitting, heavy workouts every single day. And with those things, you can also run your system down pretty quick. It can also be too much for your body. So you kind of have to find the balance with things. That's the chemical side of things. That's the physical side of things. Working on your body structurally can be very important. A lot of people recommend stretching. I'm not a huge fan of stretching. I don't think stretching really gets to the root of issues. I think using like a massage ball roller and massaging your muscles and fascia is actually really quite more effective. And those things are like $10. You get this, Amazon or Walmart or whatever. Those are some of the keys. Obviously, sleeping is super important. Having healthy relationships around you, having community, having love in your life, having purpose, like all of those things are meant for us because it's how we were designed. The Bible says that we were made imago Dei. That means in the image of God. That means we have purpose. That means we have intelligent design, and all of those things help us with our health. So many people think that health just comes down to nutrition and managing stress and supplements and all that stuff. It's so much more than that. So much more. It's your mind, it's your thoughts, it's your sleep, it's relationships, community, serving other people. One of the biggest things, one of the most interesting things in the scriptures, it says, God says it's more blessed to give than to receive. And it's like, that's really interesting if you think about that. So if you're giving money to someone, the Bible says you're more blessed to give that $100 than to receive $100. That's interesting. The Bible says that in that scenario, you're more blessed to give someone an hour of your time serving than to receive an extra hour in your day. You're more blessed. And so I think that one of the things that we can do when we talk about health is talk about, hey, this is how God designed us to live, to be selfless, to love other people. And all of those things ultimately are amazing blessings.
Yes. Oh my gosh, totally. And I agree with that 100% because this podcast is my way of giving back. I do so much research on who I want to bring, the kind of content I want to create. And when I'm going through this process, I just have all these happy hormones producing because I'm so excited to share them. And it is a sense of purpose for me because, in my life, I've had amazing people come into my life and introduce me to things that I never even knew existed. And because of that, I am who I am today. My eyes have been opened many times to things that are toxic, and I didn't even know that they were toxic. From eating organic food to being more mindful about the things I consume in terms of modern medicine, the drugs, the vaccinations, a lot of the things, and even who to interact to. I think we also have to be very mindful of our personal space, right? We as humans, we are social beings, but we also need to know that we need social rest. We need to take time out and just be in silence and be with ourselves. So I think all these lifestyle changes really do help and really help us become the better version of ourselves. So thank you so much, Dr. Joel, for going through that list. I think if everyone puts in 1% of effort every day into any of these areas, I think we can definitely work towards a better world, because at the end of the day, who we are does impact the other person that we come in contact with. And if we can be 1% better, I think the world is going to be a much happier and safer place. So
That's good. That's good. I like it.
Do you have any parting words, Dr. Joel?
I thank you for having me. It's an honor that you would think so highly of me to have me on. For the listeners, I think my last parting words is something along the lines of, you have one body, take care of it. And if you take care of it, it'll take care of you as the years go on. And just realizing that, what we put into our body, it matters. The thoughts we think matter. Movement matters. So, spend time diligently learning and trying to grow in those things. And like you said, 1% every day is an amazing thing to aim for. You do that and you look back over even 1 week, 1 month, a year, 5 years, and your life is totally different, totally changed. And not only yours, but your loved ones as well. And so do it for yourself, do it for your loved ones. And I think that will be much more doable when you have the people behind it. And I think the last thing that I always encourage people with is to read the Bible and spend time with God. I know there's a lot of different religions and so forth. But what I have found to be true, and in my testimony, is that the Jesus of the scriptures, he came and he said he was the way, the truth, and the life, and that no one could get to the Father but through him. And so that's the message that I share with people, and that I ask people to consider. So that's the message that I have put my faith and trust in, and I have seen anxiety be totally gone. I've seen peace come into my mind and heart within literally a split of a second. Just him taking heavy things off of me. I have seen wisdom and discernment. I've seen understanding for everything that's happened in my life, or a certain season, or a certain situation, and I've also seen healing as well. Life as a Christian, life following Jesus, is not it's not perfect, and oftentimes it's actually not necessarily easier by any means. Oftentimes it can be harder, but the God of the universe is with you, and so. Not only that, there's life, and of course life once you die, that's found after that. So those are my last words. Thank you so much for having me. I guess for listeners, if you want to find out more about myself, our podcast that I do, myself and Dr. Tim Augustiniak, he practices very similar to myself, and we met at school and just have stayed connected. The practice is called Freedom to Flourish, the Freedom to Flourish podcast. We release about one video a week, and really try to talk about different health conditions, and really get into nitty-gritty health stuff. Otherwise, you can find me on things like Instagram. If you just search up Dr. Joel Miller, you should be able to find me. I don't do a ton of work on there, but try to do some every once in a while. And then, if you guys ever have questions or need help, reach out. The website is drjoelmiller.com. Would be happy to chat with you, or set up a free consult and try to point you in the right direction, or work with you if that's what you need.
Absolutely. Thank you so much, Dr. Joel. This was wonderful. And to those who are listening, I hope you found this incredibly helpful. And please join us again. Thank you. Thanks for listening. I hope you enjoyed this episode. Don't forget to check the show notes for resources. Join me next time as we explore more real and essential topics. Take care.